everybody. Hope this message finds you well. We created this YouTube video channel in hopes of bringing some vital information to the community about very important women's health topics and general health topics. And I really want this to be valuable to you at all levels, but I want to bring some simplicity to the discussions that sometimes seem to be so complex in medical terminology, one of which is STI testing and STI treatment. These are sexually transmitted infections, sexually transmitted diseases. These are so important for everyone to be aware of, to have knowledge of, and to get screening for. As many of you know, STIs, some of them, HPV is popular in the literature and discussion forums right now, can cause cervical cancer, vaginal cancer, and can cause severe morbidity and sometimes even mortality. So these are organisms and disease processes that are so very vitally important to get diagnosis for and get treatment for. And what's most important is you don't need to be frightened or feel embarrassed or feel concerned about coming to your clinician and mentioning these issues to them so that you can have testing. I mean, the testing is so minimally invasive. It's not a majorly painful process. It's something that can be done very quickly. It can be literally a process of 15-30 minute session with your clinician, and it can answer a lot of questions and prevent a lot of disease and comorbidity and illnesses. So please be aware that there are some strains of organisms now that are becoming resistant to treatment, and so it's so vitally important that you get your screening done. Many patients are unaware that they have an STI and may have something that's been dormant and they didn't know it. And so it's something that never hurts to mention to your clinician, get testing for, and certainly if you think that you have a clinical abnormality or something that's happening to you with your healthcare or some symptom, please go to your clinician. We treat this as obstetrician gynecologists. We treat this every day, multiple times in a day. So please don't hesitate. Family practitioners can treat this, OBGYNs can treat this, nurse practitioners, physician assistants. Please mention any unusual symptoms and or concerns that you have to your clinicians, and let's be sure that everybody stays healthy, because these STIs can cause a lot of disease. They can, of course, cause a lot of comorbidity. They can cause infertility. They can cause pelvic abscesses. They can cause cancer in some circumstances. So these are important topics. So please talk with your clinicians. Don't be frightened about it. We'll help you. Take care.